If your testosterone is low and you put it back to, optimal levels, optimal where you would be when you're 25, 30 and you're like 45, 50 years old, it has tremendous health benefits.
TRT is changing the game worldwide for a lot of men, and it's improving the quality of life, especially as it's becoming more readily available and understood. And since going in hands myself, it's been an education, but there's still a lot of misinformation when it comes to TRT, and a lot of people are not using it optimally. Here's some of the most common mistakes that you might be doing. Taking large dosages. Instead of spreading your weekly dose or microdosing between 4 to 6 injections, you're taking it in one big bolus weekly, bi-weekly, or even monthly. The reason for microdosing is it gives you a more even spread. That means it reduces the side effects and it allows your testosterone to be distributed a little bit more like your testes would in real life. Using really big harpoon needles. You don't need to use big needles. You can inject sub-Q. Intramuscular is still the best, and using small 29 gauge insulin needles can be really effective. It stops scar tissue, it helps prevent going into any unnecessary arteries or places that you shouldn't be injecting in, and it's overall a lot more sustainable long term, especially when you're microdosing and doing multiple injections. Starting on a dose that is too high. Oftentimes, men can start at a lower dose, 125 to 150 milligrams of testosterone a week, and get a meaningful impact and increase. Then they can retest after 2 or 3 weeks, check where the level's at, and adjust accordingly. It's much better to start at a lower level and then increase over time and get more from less. Once again, this is a way to lower the risk and get more out of your testosterone. Not using high quality testosterone. Where possible, you want to get this prescribed through a clinic and use the highest grade or as close to pharmaceutical grade as possible. You want to make sure what you're getting is what you're getting and what you're really taking. And in Australia, you've got some great places like PED Australia where you can get testing kits if you're using UGL to make sure what you're putting in your body is what you're buying. Not massaging after doing the injection. This is something that gets overlooked a lot. When you inject your testosterone, oftentimes the carrier oil sits under the skin. So to distribute it and help it absorb in the body, it's good to do a little massage for 30 seconds, even up to a minute, depending on how much you're injecting. And by doing this, you can avoid infection. Getting regular blood work. Just because you've taken the testosterone doesn't mean you're taking the appropriate dose. You want to make sure you can see what's going on and adjust accordingly over time and work with someone who knows what they're doing. Because sometimes doctors won't actually check this. There are some great doctors out there, but a lot of them are not really up to speed in this space. Rotating your injection sites. Don't just go into the same site every time. The body needs a rest. You don't want to cause inflammation, so you better to rotate injection sites depending on the frequency of which you inject. That way, the body gets a rest, you're rotating it around the body, and you're distributing it accordingly. And these are just some of the most common mistakes that I see. TRT is phenomenal, but it still needs to be paired up with quality sleep, nutrition, and a structured training program. And if you do all these things in synergy, you will enhance your health, you will lower the risk, and you will optimize your testosterone.